Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking about Women's Wellness Place with manager Luann Black. Luann, welcome back to Today's Health.
Oh, thank you, Barb.
Can you just give us a brief overview of the services you offer in Women's Wellness Place?
Well, Women's Wellness Place really strives to offer a variety of services that are important to women, all located conveniently in one place. Beginning with Well Woman Care, Dr. Peter Zen is our gynecologist, and he does annual physicals. We have mammography, ultrasound. We do breast ultrasound, but we do a variety of other ultrasound studies, bone density. We are also set up to do both stereotactic and ultrasound-guided biopsies, should a woman need that. And we have Wismer Outpatient Lab right next door, so somebody can actually come in, see Dr. Zen, get their mammogram, their bone density, and their lab work all in one visit, and then treat themselves to a massage, because we also have a massage therapist with us. And we have a nice little marketplace where women can pick up something to pamper themselves with as well.
Wow, that's a busy place, a lot going on, and a great opportunity for women.
It is. We are really proud of women's wellness, and we work to create just a calm, nurturing, professional environment so that people feel comfortable when they come in for a visit.
And you do a great job, by the way.
Thank you.
Let's focus a little bit more on the breast health services, and tell me what's new.
Well, that is very exciting in our area these recent weeks, because we are in the midst of having new equipment, and we really pride ourselves in always having the best technology that we can, and we have all new mammography units that have both the traditional 2D imaging capability, but also the newest 3D imaging capability. And so it's an exciting time for us. We've also done some renovations, and we're continuing to have our private dressing rooms, which our patients all like, so that they can have that private dressing room go right into the mammography suite. And so it's very convenient and very private, and it makes just a really nice visit.
Well, you're busy then if you're doing new technology and building.
Yes.
So that's and keeping everything going, I'm assuming.
Absolutely, we continue services throughout this, and it's been going actually really well. Some of our patients, when we've mentioned about the renovation, they don't realize that it's going on. So we feel good about that.
As you should. Well, I think we're all excited to understand 3D mammography a little better, and you've brought a video, so let's watch that now.
Perfect.
There's a new tool in the fight against breast cancer. It's called Hologic 3D mammography. 3D mammography is a new kind of breast exam. It looks and feels like a regular mammogram, only it takes a few seconds longer for each view. That's because the X-ray arm swings over your breast, gathering enough extra information to create a three-dimensional image set. So now the doctors can see and search through your tissue in 1 millimeter layers. Why is this a good thing? Well, a traditional 2D mammogram shows all the breast tissue at a glance. That means one feature can hide in the shadow of another. So it might look like there's cancer where there isn't any, or there could be a tiny cancer we just can't see. 3D mammography is different because it shows your tissue in very thin layers, almost like turning pages in a book. That makes it easier for doctors to see if there's anything to be concerned about. There's less chance for a cancer to hide behind overlapping tissue. It also means there's less chance your doctor will call you back later for a second look, because they can see more clearly now. And yet, for all the extra clarity it brings, your X-ray exposure is only about the same as a traditional mammogram done on film. That's well within the safety limits set by the health authorities. We can't prevent breast cancer, but if we find it early enough, we can stop it before it stops you. 3D mammography is one more tool to make early detection even earlier.
Well, that is just amazing technology, Luann.
It is. It's very exciting because of the clarity of the images, the fact that cancers can be detected when they're very, very early. So very early detection means great survival rates. And it also reduces the callback rate, which reduces the anxiety for women in our community, because that always produces a little anxiety when you're called back for some additional views.
Well, I know as women, we all want to make sure that the people that are giving us the care are giving us the best care possible. And of course, the television news is always challenging us on that. So what you've done is been credited by the American College of Surgeons as a breast imaging center of excellence. Can you tell me about that?
Well, the Breast Imaging Center of Excellence really can give our community confidence that we not only meet all of the requirements of the modalities in mammography and ultrasound and stereotactic biopsy, but that we have voluntarily sought additional certification and have met higher standards, and that are reviewed by a peer group, and they're looking at our images, they're looking at the skill of our staff and our radiologists, our quality assurance programs, and our continuous improvement. And so it kind of reflects our commitment of excellence, which is one of our hospital's values.
Now, you've told us about some awesome technology, and I'm thinking about the women that can't afford a mammogram. Is there any help available?
Absolutely. We are very fortunate in that we live in a community that recognizes that this is a need, and they want to be sure that there isn't a woman who needs a mammogram who isn't getting one because they don't have insurance. And through fundraising and donors, we have what's called our Women in Need Fund. It is made up of two funds, actually, one being the Indigent Mammogram Fund, one being a Donna Neester fund. And so for women who are uninsured, we are able to provide mammography, breast ultrasound if that is what they need, or we can even help with the cost towards a biopsy if that's what's needed.
So if our viewers are thinking, wow, I need some more information about that, how might they go about doing that?
Well, they could, we do need them to have an order for a mammogram.
Okay.
And with that, they can actually call and schedule an appointment with our call center and tell them, I don't have insurance, I'd like to fill out the Women in Need form when I come in.
Okay.
When they come in for their appointment, it's a very brief form that they fill out, and we take it from there and we stay in contact with them until that's resolved.
Great, exciting times for Women's Wellness Place.
It is.
Thank you for joining us.
Thank you so much.
Stay with us, we'll be right back.